Welcome to this NHSN webinar, Patient Safety Component, Updates to the 2018 Annual Facility Survey. I'm Scott Decker, a public health analyst from CDC's Division of Healthcare Quality and Promotion. I will be joined by several subject matter experts within the division to provide explanations of some of the new additions and features available in the most recent Patient Safety Annual Survey. Please be advised, this webinar was originally recorded on December 12, 2018. But there will still be a live Q&A at the conclusion of this presentation. If you have a question, please enter it in the chat box on the bottom left of your screen. If we do not answer your question during the presentation and you will still like it answered, please send them to nhsn@cdc.gov. Copies of this presentation and recording of the webinar will be sent to all emails that registered prior to the event. Recipients will have 24 hours from the completion of the presentation to access those resources before they're removed. The intended audience for today's webinar are NHSN users who follow the patient safety component. There are several components available in NHSN that have their own specific survey, but today's presentation will focus solely on patient safety. This webinar will especially be helpful for users and hospital staff who complete the 2018 annual survey. During this webinar, we will provide an overview of the annual survey and how it can impact your facility's SIR calculations. We will show you how to add, edit, and analyze current and past annual surveys. There will be a detailed review of how to define the various medical school affiliation options for hospitals. Subject matter experts will introduce new questions and updated sections to the annual survey, as well as provide detail for their inclusion on the annual survey. At the conclusion of this presentation, we will have time to take questions from participants. I will spend the next few minutes today with providing an overview of the Patient Safety Annual Survey and how it is used in NHSN analysis for the generation of the Standardized Infection Ratio, commonly known as the SIR. The annual facility surveys are completed in NHSN to gather facility characteristics and data from the previous calendar year. The Patient Safety Annual Survey has 3 separate survey types that can be seen on the screen. Facilities are provided with the appropriate surveys based on the facility type that was selected during their initial enrollment in NHSN. Completion of the annual survey is mandatory for all enrolled facilities in NHSN. The content of all these surveys forms are divided into different sections that are noted on this screen. These demarcations can help guide users in their identification of appropriate staff that may be needed to assist them in completing their survey. In addition to providing CDC with updated information about facility characteristics and practices, the annual survey provides information that is used for various HAI's SIR calculations. Certain data that changes from one survey year to the next that are applied to these measures can be responsible for a change in an SIR. The NHSN published guide to the SIR provides a breakdown of each facility type and HAI that uses information for the annual survey that is used in the generation of the SIR. This is a great resource for users to gather interpretations and explanations of why an SIR can change from one year to the next. SIRs use a corresponding annual survey that matches the year of data that is being analyzed. If an annual survey has not been completed for a year in which data is being analyzed, the data will be risk adjusted using the most recently completed survey. 2018 data will not be risk adjusted using the 2018 survey until it's completed in NHSN. Instead, it would continue to use the 2017 survey in absence of 2018. Facilities that have yet to complete the 2018 surveys are encouraged to complete them as soon as possible. This is an example of how different responses to the medical school affiliation question from one year to the next can impact the SIR for CAUTI infections within critical access hospitals. Within this facility type, facilities that select undergraduate as their medical school affiliation type have found to have a higher incidence rate of CAUTI infections compared to facilities who may have major, graduate, or no medical school affiliation. The image on this screen is taken from the NHSN Guide to the SIR and provides information about the impact each selection has on the CAUTI SIRs within the critical access hospital. Every table within this guide includes footnotes that indicate data that is taken from the annual survey. The table on the top left of the screen is an SIR report taken from NHSN. The 2016 Q1 CAUTI SIR was calculated using survey data that indicated that this facility had selected undergraduate as their medical school affiliation. This can be identified on the screen by observing med type equals U, highlighted in the top corner of the first table. The second table on the lower right is an SIR report from Q1 of 2017, but this facility has indicated no medical school affiliation on their corresponding survey. Please take time to compare the number of predicted events on each table. The row is highlighted in green on both of these tables. The example assumes that data from both quarters are identical, and the cause for the change in the number of predicted infections from one year to the next was the difference between medical school affiliations selected on each survey. It's important to understand the relationship between the annual survey and their impact on specific HAIs in your facility. NHSN recommends that users access the guide to the SIR whenever they're interpreting results from various SIR reports. At this time, my colleague Agasha Katabara, a public health analyst with NHSN, will now provide information about how to access, edit, and analyze your annual survey.
Thank you, Scott. Good afternoon, everyone. My name is Agasha, as Scott just said. I am one of the survey subject matter experts here at NHSN, along with Scott Decker. Today, I will be reviewing with you how to add, edit, and analyze the 2018 annual survey. I will also touch on how to troubleshoot the medical school affiliation question on the annual survey and provide you with an overview of the new changes coming to the 2018 hospital annual survey. So there are two options on how to add a 2018 annual survey. Let's begin with, you can first add the annual survey from the NHSN homepage by clicking on Surveys and then selecting And, or you can select the survey required alert box on the NHSN's homepage. So the first option is navigating to the NHSN homepage to add the annual survey. What you will need to do is navigate to the left-hand menu of the NHSN homepage, scroll down to Surveys, right-click on it, and you will see a button that says And. Click on the And button, and it will lead you to this screen right here on the presentation called the Add Annual Survey screen. On this screen, you will select the survey type and surveyor, and for this year, it will be the hospital survey data, and for the surveyor, you'll be entering in 2018. You will have to enter all the required data in the survey and click Save for the facility survey to save. The second option might be a little straightforward. All you need to do is to click on the survey required alert on the NHSN homepage. This action will lead you to the appropriate survey type and year for completion. You do not need to email or fax an NHSN copy of the completed survey. Once you click Save, we've got your survey, and now your survey can be used for risk adjustment in the appropriate SIR calculations. After you have completed and saved the survey, you may want to make some changes to your 2018 annual facility survey. You can do this by using the Find feature in NHSN. On the NHSN homepage menu, select Surveys again and click Find. Please note that you can edit the annual survey at any time. Any changes made to the 2018 annual facility survey after the CMS deadline on February the 15th, 2019 will not be reflected in the CMS SIR reports sent to CMS for 2018 Q3 data. Once you have clicked the Find on the NHSN homepage menu, the application will lead you to the Find Annual Survey page. You will need to enter the survey type and the survey year from the drop-down menu. Click Find and go to the survey. To edit the survey, you will need to scroll down on that page and select Edit. You can also find a survey by leaving all the fields blank and just selecting Find, and all the saved surveys will be listed from the selection box. Now that we have gone through how to add, find, and edit the annual survey, let's go over how to analyze the annual survey in NHSN. Analysis of the annual survey using the NHSN datasets is a good tool for routine data quality checks. Survey responses found in these reports can be easily compared amongst multiple survey years. These reports can be found on the NHSN reports page. You can find these reports by going to NHSN left-hand menu, clicking on Analysis, and selecting Reports. On the Analysis Reports page, scroll down and open the Advanced folder. In the Advanced folder, open the Facility Level Data folder. You will then notice that there are a bunch of line listings for you to select from. In this example, we'll be using the 2015 to 2017 hospital survey line listing. You can either choose to run the line listing report as is or modify it to represent the data you would like to see. To modify the report, select Modify. A modification tool will pop up. This tool allows you to edit the survey line listing report. Here you can choose a specific survey questions or variables to display by highlighting them from the Available Variables box and moving them to the Selected Variables box. For more information on how to use the modification tool in NHSN, we recommend that you review the How to Modify a Line List resource guide. This guide contains more information on how to save and export your reports. A link to this report will be provided at the end of the presentation. After all desired modifications have been made to your report, select Run. The output will be ordered by survey year and will include all completed surveys. Information found in the reports can help explain potential data quality issues found in other analyses. For example, a change in medical school affiliation and or change in number of beds can affect your SIR score, since these variables are used in risk adjustment in the SIR calculation. We also wanted to take some time to address the variable medical school affiliation, since it's one of the most frequently asked questions regarding the annual survey. This is a question on the NHSN survey that asks, is your facility a teaching hospital for physicians and or physicians in training? Our hope is that this next section of the presentation will give you a better understanding of this variable and uncomplicate any thought processes regarding this question. There are three different levels of medical school affiliation. These are major teaching, graduate teaching, and undergraduate teaching. Major teaching facilities are a facility that trains medical students, nursing students, and postgraduate residents. Note that there is no minimum number of students that must be present in your facility to meet this designation. It is not necessary for your facility to be attached or affiliated with a medical school. The next level is graduate teaching. Graduate teaching facilities train postgraduate, which are medical, MD, or DO only residents or fellows. Last but not least is the undergraduate teaching facility. This facility trains current medical school students and or nursing students. What you will be doing on your annual survey is selecting the highest level that your facility meets. So we will go through some scenarios that we frequently receive in our mailbox just to help uncomplicate this question. So the first scenario is a hospital has 10 graduate level nursing students and medical students present in their facility for rotations. What options should this facility select on their survey? I'll give you a couple of seconds to think about this. The answer is undergraduate level. The rationale is the facility has both nursing and medical students doing rotations. Graduate level nursing students do not qualify for graduate level status in the NHSN definition. Designation is only for MD or DO fellows and residents. The next example is if a hospital has 3 pharmacology fellows doing training at the facility's pharmacy. What options should this facility select on their survey? Dan, I'll give you a couple of seconds to think about this. The answer is no medical school affiliation. The rationale is only medical and nursing students should be considered for these categorizations. If a facility does not have any level of nursing and or medical students present during a given calendar year, the facility should not select a medical school affiliation. So in summary, you have 3 levels: undergraduate, graduate, and major teaching. They go in succession. If you only have medical school students and nursing students, you're undergraduate teaching. Once they go higher in educational level, you have residents and fellows. If you only have residents and fellows, then you are now a graduate teaching facility. If you have both graduate level medical residents and fellows, and you also have undergraduate, which are medical school students who have not yet obtained their MD degree, and nursing students, whether they are graduate level or undergraduate level. If you have both those categories, you are now a major teaching facility. Let's move on to what's new on the 2018 Patient Safety Component Annual Survey. As Scott mentioned earlier in this presentation, the 2018 Patient Safety Component Annual Survey is rolling out a good number of noticeable changes. These changes have been made to make the annual survey easier to navigate, reduce data entry errors, and to obtain more information. Changes to the annual survey include added alerts to remind facilities to complete the appropriate surveys, updated response options to reflect changes for certain laboratory testing methods, soft warnings added to reduce data entry errors, new logic and skip patterns implemented to reduce burden, and new questions added about neonatal patient care practices and antibiotic stewardship practices. You will notice in NHSN, if you have a CMS IRF unit, that there is now a new alert. This alert has been generated for hospitals that have an active designated CMS inpatient rehabilitation facility mapped within their facility. These are also known as CMS IRFs. What is a CMS IRF unit? This is an inpatient rehabilitation facility located within an acute care facility that either has a T or an R in the third position of its CCN number. These units have a required supplemental survey to complete. Information on this survey should only be taken by designated CMS IRF units. Selecting this alert will take users to the required survey form for completion. There's also another new alert called Partial Survey. This alert is for newly enrolled facilities that were not operational in the past calendar year. During the enrollment process, the facility is required to complete a survey. Facilities that were not operational will not be able to complete a full annual facility survey. They are therefore required to complete a partial survey. This partial survey does not capture all the required fields used by various HAI-SIR calculations. Facilities that have reporting requirements during their enrollment year need to complete this partial survey to calculate an SIR. We recommend 6 months of data to be collected before entering the partial survey data. You will need to complete as much as you can prior to a reporting deadline. Usually information that you may not have will be grayed out for you in order to allow you to save the survey. The partial survey is not required to be completed in order to enter data into NHSN during your enrollment year. Ignore the alert and it will disappear the following calendar year when the full annual survey will be required. As you complete your 2018 annual facility survey, you will notice a new section called the Facility Neonatal Patient Care Practices and Neonatal Admission Information. This section includes 6 new required questions about neonatal antibacterial use to assist in the creation of a neonatal-specific benchmark matrix. This section is to be completed with input from an NICU medical director, lead neonatal physician, neonatal nurse manager, and/or lead neonatal nurse practitioner. Here you will hear more information about this section later in this presentation. At the end of the survey, you will also notice that the antibiotic stewardship practices section has grown. Previously, this section only included 11 questions. The new 2018 survey now includes 20 questions. 10 of these questions are required, and the other 10 are optional. More questions have been added to provide more granularity and context for facilities' antibiotic stewardship practices. All questions will continue to align with the CDC's core elements of hospital antibiotic stewardship program.
At this time, we're going to give the floor to Aaron O'Leary, a health scientist in the surveillance branch that supports NHSN, to provide an overview of the new neonatal-specific survey questions. Welcome, Aaron.
Hi, thanks, Scott. Hi, everyone. So as Scott mentioned, my name is Erin O'Leary, and today I'll be discussing neonatal-specific survey questions that have been added to the annual survey, along with some background into why these questions were developed. So first, to start off with some background, hospitals participating in NHSN antimicrobial use, or AU option, have access to various analysis tools, including the Standardized Antimicrobial Administration Ratio, or SAR. And the SAR is a metric that compares observed antimicrobial use to predicted antimicrobial use for specific patient care locations and groups of antimicrobials. And predicted use is calculated using nationally aggregated data that are risk-adjusted for location and hospital-level characteristics. At this time, SARs are available for specific adult and pediatric locations. Because neonatal antimicrobial use differs greatly from adult and pediatric use, CDC is currently working to develop SARs for neonatal patient care locations. And new neonatal-specific survey questions were added to the survey in order to capture hospital-level information potentially necessary for risk adjustment in SAR predictive models. And all questions were developed in collaboration with the Vermont-Oxford Network and subject matter experts across the country specializing in neonatology, infectious diseases, and antimicrobial stewardship. So I'm going to walk you all through the questions and provide some background into why each question specifically was developed. So the first question, question 25 on the survey, asked, was this section completed in collaboration with your facility's neonatal patient care team? And the question is meant to encourage respondents to seek input when answering detailed questions pertaining to neonatal patient care practices and neonatal admissions data in order to maximize the accuracy of responses. And hospitals that do not provide neonatal patient care will select NA, and they will move on to the next section of the survey. Question 26 on the survey asks, excluding level 1 units, record the number of neonatal admissions to special care nurseries and intensive care units for both inborn and outborn admissions. And question 26 asks, for those same locations, record the number of neonatal admissions, again, both inborn and outborn, in each of the 5 birth weight categories listed. So hospitals with newborn nurseries but no special care nursery or NICU would enter a 0 for each portion of these admissions-related questions. And for hospitals reporting admissions information, the sum of A and B in question 26 must equal the sum of A through E in question 27. And the purpose of this question is to assess whether hospitals with different numbers of annual neonatal admissions or differing proportions of admissions by birth weight may be associated with differing rates of neonatal antimicrobial use. And admission information gathered through these questions will be assessed in predictive models and included as risk adjustments if they are found to be significantly associated with antimicrobial use. Question 28 of the survey asks, does your facility provide level 3 or higher neonatal intensive care as defined by the American Academy of Pediatrics? And then there's some more specifications listed. And question 29 asks, does your facility accept neonates as transfers for various high-risk complex procedures which are subsequently listed? And hospitals providing higher levels of neonatal intensive care may require use of antimicrobials in NICUs at higher rates than hospitals that might only provide low complexity patient care. So the association between neonatal antimicrobial use and level of neonatal care will also be assessed in SAR predictive models. Lastly, question 30 on the survey asks, if your facility administers antimicrobials to newborns residing in their mother's room, to which NHSN location or locations is the baby mapped? In many hospitals, newborns are often roomed with their mother rather than a separate designated nursery, which may increase the complexity of accurately capturing antimicrobial use in this population if a hospital inadvertently maps babies in NHSN to a mother's room rather than a level 1 newborn nursery. So this question was added to help us better understand hospitals' location mapping practices and whether, just to make sure hospital-wide neonatal antimicrobial use is being captured fully in NHSN. And that is all for neonatal-specific updates. And feel free to submit any questions that you might have to the Q&A box, and we'll do our best to answer those. Thank you.
Thank you, Erin. We're going to continue to highlight new additions to the annual survey. To present information about updates made to the antibiotic stewardship practices section, we have Anita McLeese, an evaluator within the Prevention and Response Branch for the Division of Healthcare Quality Improvement, who focuses on measuring hospital antibiotic stewardship practices. Welcome, Anita.
Thanks, Scott. Hi, good afternoon, good morning maybe for some of you still. As Scott mentioned, my name is Anita McLeese, and I'll spend just the next few minutes reviewing updates to the antibiotic stewardship practices section of the survey. And I believe that this is the section with the greatest number of updates for this year. So I will spend the next 5 to 10 minutes or so walking you through why the revisions were made, what the changes are, and the implications of the changes for you. Okay, so the updates you will see in this section were made to improve our understanding of antibiotic stewardship practices and implementation of the core elements. We've been really encouraged to see how the number of facilities meeting the core elements has increased over the past few years, and we hope that by expanding this section, we can gain a deeper understanding of facilities' antibiotic stewardship practices and, in turn, offer more specific guidance and support for these programs. The updates you will see are based on a pilot study that we conducted in 2017. We vetted with the antibiotic stewardship community a pool of questions that were derived from the 2017 NHSN survey, from literature on the subject, and from some existing surveys in use by some of our partners. We obtained feedback from infection preventionists and pharmacists located in small, medium, and large facilities, from academic and non-academic hospitals, and from critical access hospitals, as well as from some others that work in other positions across various health systems, to ensure that these new questions or revisions to existing questions really do reflect relevant and important advances in antibiotic stewardship practices since the release of the original survey questions. So I'd like to now provide a quick overview of the changes you can expect to see. But first, we want to emphasize that the core elements themselves have not changed, nor in the vast majority of instances should your facility's ability to meet them. So we made revisions to existing questions and added some new questions. The revisions to the existing questions were largely minor, with one exception that I will address on the next slide. The more minor revisions include such things as allowing for both policies and formal procedures under certain types of actions. When referencing the use of treatment guidelines, allowing for the use of both facility-specific and regional guidelines, and specifying the types of staff who receive education. We've also added some new required questions and response options that, again, are based on advances in what we know about antibiotic stewardship practices. What these additions really mean for you is that essentially there are now some additional opportunities to demonstrate achievement of the core elements. So we're not trying to make it harder for you to meet the elements. We're actually hoping that this will provide additional opportunity. This added information and detail will also provide data that help us hone in on what really makes stewardship practices and facilities successful, to again inform more tangible guidance and support in the future, and also to help us collectively better target our stewardship practices for higher impact. So finally, there is also now a new optional section. And while the information gathered here is valuable to our understanding of stewardship practices, we do recognize the burden of completing the survey, which is why we have deemed some of the questions optional. What this section means for you is that you do have the option of very generously, we would appreciate it, providing this information about your facility. We obviously encourage you to do so, as the information will be helpful for both your facility as well as for CDC to understand these aspects of stewardship practices. But that said, answers to these questions will not affect whether your facility meets a core element. In the future, though, depending on what we learn from this area, it is possible that some of these questions may move into the required section, but for now they are optional. And because of some of the changes to this section, we do strongly encourage you to work with your stewardship lead when completing this part of the survey. So as I just mentioned a minute ago, there is one exception to the minor revisions to questions in last year's survey. Question number 26 in the 2017 survey, which focuses on salary support, has been removed from this year's survey. Previously, this was one of the two ways that a facility could qualify as having the leadership core element fulfilled, but we received feedback during our pilot testing last year that framing leadership commitment as salary support was not easy to answer for many facilities, and that salary support alone was not ideal evidence of leadership support for a stewardship program. If salary support was the only way that your facility was addressing the leadership core element, your facility will need to engage in a different type of activity in order to meet this element. That said, if this is the case for your facility, you will have received an email from CDC, or you have received an email from CDC on December 6, 2018, sent to your facility, NHSN facility administrator. So additional ways that a facility can meet the leadership core element include a formal statement of support for antibiotic stewardship, which remains unchanged from last year, the physician or pharmacist leader for stewardship activities having antibiotic stewardship responsibilities in their contract or job description. This option is similar to the concept of salary support, but was modified based on feedback during our pilot that inclusion of responsibilities in a formal job description or contract is more consistently feasible to track and identify than salary support. And then there's some additional opportunities to demonstrate leadership commitment to stewardship efforts, including communicating to staff about stewardship activities, providing staff training and development on stewardship, or allocating information technology resources to support antibiotic stewardship efforts. There is one additional item worth noting, which is the addition of a response option in the question about monitoring activities related to monitoring Clostridium difficile, given the relationship between antibiotic use and C. diff infection. While most of the questions or response options related to monitoring and tracking remain the same as previous years, so monitoring antibiotic resistance patterns, days of therapy, defined daily dose, and expenditures, we wanted to bring to your attention that only selecting the option of monitoring C. difficile, which is new, or only selecting the option of monitoring antibiotic use in some other way, which is carry forward from the prior survey, will not meet the tracking criteria. To meet that core element, we are still focusing on the more standard approaches to monitoring antibiotic use, such as days of therapy, defined daily dose, expenditures, and monitoring antibiotic resistance patterns. So in summary, the key takeaways for the revisions to this antibiotic stewardship practices section are: revisions include primarily minor edits to existing questions and the addition of new questions, some required and some optional. All of the edits are intended to reflect advances in antibiotic stewardship practices since the release of the last version of the survey. Aside from the removal of the salary support question, these should not affect your ability to meet the core elements. The expansion of the survey will provide additional opportunities for meeting each core element, aside from that one example I just gave, and provide more and better data to CDC and the reporting facilities to improve our collective understanding of antibiotic stewardship practices. And again, we strongly encourage facilities to work with their stewardship leads to complete this portion of the survey. The one last thing I would like to note before I close is that we're almost done with developing a document that crosswalks the new survey items with the 2017 survey organized by core element. The crosswalk will be available on the NHSN website in early 2019, and an announcement from NHSN will be made to notify users when it is published online. Thank you.
Thank you, Anita. Before we get to everyone's questions, I want to spend a few minutes going over some important reminders related to the annual survey and some resources that can help you complete it. Please plan to spend over an hour completing the 2018 annual survey in NHSN. We suggest that whomever is responsible for completing the survey should first print off a copy of the blank survey form and review it. This will allow you to identify certain individuals within your organization that you may need input from in order to complete specific questions. Each blank form of the survey includes a link to a table of instructions that provide further clarifications to assist in the completion of the annual survey. You must complete the annual survey and NHSN application in one sitting. You will not be allowed to save partially completed surveys. Surveys that are not saved with responses to all required questions will be lost. This is a gentle request to please not send completed copies of the survey to the NHSN mailbox. Simply saving them in NHSN will be sufficient. Finally, once you've saved your survey, please regenerate datasets and then use the survey line list to verify its submission. The 2018 Patient Safety Annual Survey is now available in NHSN for completion. Copies of the blank surveys and corresponding instructions can be accessed via the NHSN website. A link to where you can find these forms is available on our resources slide at the end of this presentation. The 2018 annual survey must be completed and saved in NHSN by March 1st, 2019. Failure to do so will result in future monthly reporting plans to be inaccessible until the survey is completed. Please be advised that the CMS 2018 Quarter 3 deadline is February 15th, 2019. In order for this data to be risk adjusted and submitted using the corresponding survey year, the 2018 survey must be completed prior to this deadline. We encourage users to attempt to have their survey saved by this date, but there will be no penalty if you're unable to. This page includes helpful links that were referenced during today's webinar, or resources that will be helpful to assist users in completing their annual survey.